Hello family and welcome to my YouTube channel. My name is Mary. If you are new to this channel, you're welcome. Don't forget to subscribe, turn on the post notification bell so you receive notifications each time I upload a new video. Don't also forget to leave your comments and your suggestions too as well. So today in this video, I'm just going to be talking to you or taking you through some of the courses we study in nursing training college as general nurses, and then also differentiate between general nursing and the health assistant nursing programs. Okay, so with the general nursing, just like the word general, we touch on almost every aspect of nursing, be it midwifery, psychiatry nursing, public health nursing, and the rest. Okay, so just like the word general, we touch on almost every aspect of nursing. And then with the health assistant nursing programs, we have two categories. We have the nurse assistant preventive, that is the NAP, and they come under community nursing. Okay, they are assistant to the community nursing, and the only difference is that their duration of study or their course duration is 2 years, and they are awarded with a certificate, and they don't do national service. And then when you come to the NAC, that is the nurse assistant clinical, they are almost also like general nurses, and they are also their course of duration is also 2 years, and they are awarded with a certificate, and then they don't do national service. Okay, that's the difference I can say for now, because I'm not really interested in certificates and things. At the end of the day, we have a common goal, and that is to save lives. But before I go into the second phase of what I want, what I have to share with you today, I want to just say something that is happening in the facilities, and then like no one is talking about it. Even when if someone will talk, people are not really serious about this thing, and it's actually not good. I just want to share it here, and that is the discrimination that's always faced by the enrolled nurses. That's the health assistant programs. When they complete, they are classified as enrolled nurses. So you like that kind of discrimination, you come to the facility with your degree, with your diploma, and then you tend to look down on these people. And I think this thing was so serious today. That was why their uniform was even actually changed to green. They were wearing brown during their training school time, and then when they go for clinicals, even the discrimination from the word even made even patients and clients to know that these people are assistants. So even some of them will tell you that even there were times they tried to even work on patients, and the patient will tell them, "You are not a nurse, don't touch me." So this thing became a very serious problem that the NMC, I think they did well on that. They had to change their uniforms to green. And the only difference between the health assistant program and the nurses, the general nurses, and the other aspect of the diploma and the degree wear the white, and the diploma nurses wear the green with the white cape. And the health assistant program, they wear the green with the green uniform with the green cape. Their cape is always is green. The diploma wear the cape is that round thing around our neck. So certificate nurses, they don't have the white thing, they wear the green, and the diploma nurses wear the white, and the degree nurses wear pure white, like overall white. That's the only difference. So they had to change these people uniforms to green just to avoid discrimination and assault from physical and emotional and verbal assault from people. And it's not fair. Okay, you just left university recently, and you are being posted to a facility, and you go to meet an enrolled nurse who has been working for almost 5 to 10 years, and then you come and you are ordering this person around. And have you forgotten that most of the things we studied in school, you will never get to see them in real sense, or even in the practical field, you don't get to see those things. For example, we learned about cardiac bed, divided bed, simple and occupied bed, and all that. When was the last time you saw a patient lying on a well-defined cardiac or divided bed in the facility or in the hospital? When? So you realize that nursing in Africa, nursing in Ghana is just improvisation. We improvise so many things. You even get the kidney dish you don't have, you have to improvise. We improvise most of the things in the facilities. So if you are using your book knowledge to come to practical field, it would disturb you. So learn to humble yourself with your diploma and with your degree and with your masters, and then Let's come together as work professionals and then save lives and stop discriminating against each other based on certificates. I am a diploma nurse, you are not my class. I am a degree nurse. It doesn't hold water. It means nothing. It's meaningless. So, yeah, at the end of the day, some of them are even very intelligent than you, the diploma and the degree nurses. Okay. The reason is that if you want to study degree and diploma, and the only thing is, if you have a D, you will not be picked. But with the certificate programs, with D, you can get admission. And then the difference is just that maybe the person might have scored almost all the subjects and couldn't make maybe one core or two. So ended up going to the certificate class doesn't make the person a nobody. Okay, maybe you probably had your A. What if you copied? Maybe you copied during your WASI and you made the A or the B, and you are in diploma class. So respect yourself and stay there. Okay, and this person maybe didn't make had a D or a D in science or maths or English or something, and because of that decided to go to do a 2-year program and further in future. And then you come and you are looking down on these people, knowing very well that this enrolled nurse is very intelligent than you are. And then you come and you are over, I don't know, overreacting in terms of certificate and thinking that you are better than anybody. Please, this thing must stop. We are all nurses. We are all nurses. At the end of the day, you need me, I need you. You wrap my back, I wrap your back. So what's the discrimination for? That was just by the way. So before we go in, and the second phase is, I'm just going to tell you some of the courses we study. The courses that I studied as a general nurse, and I think there has been changes. It's like they are almost changing some. Like it's always revolutionized. Should I use the word? Is it revolutionized? Anyway, not anyway. Let me say that it's revolving. Like it's changing. Yeah. So in general nursing, I think I listed them here, and I'll be mentioning everything in this video. So general nursing, we study sign language. Sign language. Hey, sign language. This is A. B. I think I'll go and search and come back. So we study sign language. We study French. Yes. We study marketing. You have to learn to market. So don't be relying on only your monthly salary as a nurse. At the end of the day, you have so many, your expenditure is more than your salary. Please learn to do marketing. Okay, learn to invest in businesses, and then yeah. And we do supply chain management. Okay, so you don't go to the facility and be using syringe and needles in here and discarding them and using them because they are in abundance. No, you have to learn to manage the ward as a ward manager. Okay. And we study research techniques. I never liked research in school. We study research whatsoever you are using it for. I don't know. We study basic nursing. I think we have basic nursing and advanced nursing. So basic nursing is like the word basic nursing. We study it in the first year, and advanced nursing is in the second year. Okay, and we study surgical nursing. We have surgery 1, 2, 3 per the year. So surgery 1 for first year, surgery 2 for second year, surgery 3 for third year. And we have medical nursing, medicine 1, 2, 3. So we study medicine 1 in first year, just like the surgery 2. So 2, 3, 3. And we study anatomy and physiology. This subject actually bullied people, and it's like, I actually enjoyed anatomy. Okay, the reason is I did science in the senior high school, so most of the names were familiar to me already. But there was this the art student, sorry to say, oh, the art student know you and your English and your grammar and things. When you mention some of the names, you'll be like, oh. So anatomy and physiology, and we have anatomy 1, 2, 3. So anatomy 1 for first year, anatomy 2 for second year, anatomy 3 for third year. Then we have pharmacology. We study pharmacology, so you have to know your medicines. You don't have to, when a doctor prescribes a medication and you realize that this per the dosage and this thing doesn't fit this patient, you need to call the doctor to make changes. So you don't just go and they will prescribe omeprazole, this amount of milligram, give to this patient, and you realize that this patient that doesn't actually need. And I'm not to say doctors are not intelligent, no. Anybody at all, everybody makes mistakes. Okay, so if you're a nurse, you have to have your knowledge in pharmacology, so you know your medicine. your drugs, let me say. Yes, so we study pharmacology, we study psychology. So you know if a patient is exaggerating pain, you know. We study psychology, and we study psychiatry nursing, and then we study geriatrics nursing or gerontology. That gerontology is diseases and then problems associated with the old age, okay, the old people. Yeah, so I think the whites in the Western world, they lack, they like this one of the courses they like so much, gerontology, taking care of their aged and all that. Ghana here, please, that one. And then we study first aid, accident and emergency nursing. We study perspectives in nursing or perspectives of nursing. I think that was what we studied though. But then, like I learned recently, perspectives of nursing has been changed to, is it therapeutic communication or something like that? I didn't do therapeutic communication. I did perspectives of nursing. That's the history of nursing, Florence Nightingale and the rest, and the nurses pledge, what you are expected to know, medical social, medical legal issues in nursing and the rest. That's the perspectives of nursing. And then we have communication skills in nursing. Ah, ah. And I think this subject, I don't think anyone ever had an A in this subject. So communication in nursing, and then the grammar, yeah, at least as a nurse, learn to know your tenses too as well. We are trying. Yeah, so communication in nursing, communication skills in nursing, you have to know. I think communication skills in nursing and perspectives of nursing is now under the therapeutic communication or therapeutic nursing or something like that. So how to communicate with people and understand patients. It's not only about the grammar and the things. No, how to communicate with the patient, with your colleagues and all that. So it's also important. So, and we have pediatric nursing. We have PDs 1 and 2, study pediatrics, and we study public health nursing. We study obstetric nursing. Okay, so that's the midwifery aspect. And above all, we do practicals, all that I've listed, apart from some of this like French, sign language, marketing, supply chain management, research and all that. Any other subject I've listed under the nursing field, we do practicals under all. Okay, so vacation practicum is there, internal practicum, we write practicum. Like practicum is just like at the end of every course of study, you go to do clinicals. You have internal and external clinicals. Okay, so you get to practice what you learn in the subject. You get to admit, oh, if this a surgical procedure, how do you treat a patient with this condition and all that. So mostly nursing, when you learn, you practice. Like you study, you practice, you study, you practice. That's how you become a good nurse. If it's just to go and read, chew and pour and pass, you can't be a good nurse. You have to be practically good, because you are coming to work with your practicals. And we deal with practical, we work with our hands. Not only we work with our hands and our brains, so you have to be intelligent and you have to be able to work with your hands. Okay, so that's what I'll be sharing with you today. Okay, if you don't understand anything, you can leave it in the comment box, and then I'll try to answer, or I will answer if I can. Okay, so this is what I'll be ending the video today. I hope it blesses you. Okay, and like a lot of people are asking me to do this video, and I've done it. Please, I hope it solves your problems and any other thing. So this is why we're ending the video today. Hope and looking forward to see you in the next one. Stay tuned and always keep contact. Always please subscribe if you haven't. Just subscribe, and then we'll move forward. Okay, God bless you. I love you. Bye.